Dear students, we will discuss how to interpret X-ray chest X-ray scan. Firstly, confirm details. Begin chest X-ray interpretation by checking the following details. Patient's details, name, date of birth, and a unique identification number. Date and time the film was taken. Previous imaging useful for comparison. Access image quality. Next, the medial aspect of each clavicle should be equidistant from the spinosus processes. The spinosus processes should also be in vertically oriented against the vertebral bodies. Inspiration. The 5-6 anterior ribs, lungs, apices, both costophrenic angles, and the lateral rib edges should be visible. Projection. Note if the film is anterior-posterior or posterior-anterior. If there is no label, then assume it's a posterior-anterior film. If the scapula are not projected within the chest, it's posterior-anterior. Exposure. The left hemidiaphragm should be visible to the spine and the vertebra should be visible behind the head. And students should know ABCD approaches. The ABCD approach can be used to carry out a structured interpretation of a chest X-ray. A. Airway, trachea, carina, bronchi, and hilar structures, breathing, lung and pleura, cardiac, heart size, and bodies. Diaphragm, including assessment of costophrenic angle, everything else, mediastinal contours, bones, soft tissues, tubes, valves, pacemakers, and review areas. 8. Airways. Trachea. Inspected the trachea for evidence of deviation, whether the trachea is normally located centrally or deviation very slightly to the right. If the trachea appears significantly deviated, inspected for anything that could be pushing or pulling the trachea. Make sure to inspect for any paratracheal masses and or lymphadenopathy. Causes of true and apparent tracheal deviation. True tracheal deviation, pushing of the trachea, large pleural effusion or tangent pneumothoraxis, pulling of the trachea, consolidation with associated lobar collapse. Apparent tracheal deviation. Rotation. The patient can give the appearance of apparent tracheal deviation, so as mentioned above, inspected the clavicles to rule out the presence of rotation. Next, we discuss carina and bronchus.